Vortex is brought to you by Abilities Workshop, a nonprofit organization consisting of parents who are committed to improving the lives of individuals who are living with neurological disorders, and NeuroNews, an organization consisting of healthcare professionals committed to improving the lives of individuals who are living with neurological disorders. Welcome to the Vortex. Today's guest is Dr. James Neuenschwander. Dr. New graduated magna cum laude with a Bachelor of Science degree in the honors program in cellular and molecular biology from the University of Michigan. He went on to receive his medical degree and completing 3 years of surgical residency at the University of Michigan before leaving voluntarily to pursue a career in integrative medicine. Dr. New is board certified in emergency medicine, integrative, and holistic medicine, as well as anti-aging and regenerative medicine. In addition, he is a fellow of the American Academy of Anti-Aging Medicine. He is a member of the Association of American Physicians and Surgeons, American Academy of Anti-Aging Medicine, American College for the Advancement of Medicine, and the International Lyme Association Disease Society. He has been a Defeat Autism Now DAN practitioner since 2007 and has been a member of Medical Academy Pediatric Special Needs MAP since its founding, a fellow since 2014, and currently a faculty and executive board member of the organization. He has over 30 years of experience in integrative medicine and over 25 years of experience in emergency medicine. This week we have Dr. New going to be visiting with us. He's going to be talking to us about how the gut and the GI play a part in helping our children recover and work with and heal from autism. Dr. New, thank you for being with us. If you don't mind, could you tell us a little bit about how you got here, what brought you to the autism side of the world?
Sure. So I originally trained at the University of Michigan, traditionally medically trained. Ended up going into a general surgery residency because it was a lot of fun and you actually remove disease from people's bodies, so that was a blast. Somewhere along the road, I realized I wasn't really helping my patients prevent the next disaster from happening, and that got me out of the mainstream of medicine. So I started a integrated medical practice back in 1988. Yes, that's how old I am, and was practicing integrated medicine. And then I started to see some of these kids on the autism spectrum, probably starting in the 90s. Saw a few here and there. Finally, by 2005, 2006, it was actually my wife sort of dragged me kicking and screaming into this world of autism. She got me to go to at the time it was called DAN, Defeat Autism Now, to go to a DAN conference, and it was just mind-blowing. It was this idea, I don't know if all doctors are like this, but have this idea that any psychiatric diagnosis is something you're born with and it's permanent and you can treat the symptoms, but there's not much you can do about it. But here I go to this conference and they're talking biochemistry and biochemical pathways and detox and methylation and gut disorders and yeast overgrowth and just everything that I was doing in my practice, but it was applying to autism. And that's really what started the journey. I'm also kind of a geek in terms of information and trying to stay up to date on my education. And this was just a whole world I had not heard a lot about. And that got me started on my journey. And then, of course, when you first start seeing kids on the spectrum, when you're brand new to it, you tend to get really wonderful results early on. It was just awesome to see some of these kids recover, whereas prior to that, I thought, hey, I can help them with their gut, but I didn't think I could actually recover them from autism. So it's been quite a journey since then.
Now, when you say recover, I tend to say that every child can be their best, that each and every one of them, they may or may not fully lose all of their symptoms of autism, but that they can be their best version of themselves, and they can certainly be happier and healthier. When you're saying recovery, do you feel like they can lose, that many kids can lose most of their symptoms? Define that a little bit, because I know that that's one of those words that people say, oh, no, you can't treat autism or you can't recover autism. And, what do you mean when you say that?
Well, I think that there are, autism is a spectrum. So saying somebody has autism is kind of like saying somebody has a cough. It doesn't say why you have the autism, right? So if you have autism because you have Down syndrome and you had birth trauma, then we'll be able to make you the best Downser ever, or the best Downser you can be, but you're still going to have Down syndrome. You're not going to go to Harvard. You're not going to have an IQ of 150. You're just limited by your genetics. But when I look at the spectrum of kids that I treat, there is a chunk of kids, and I don't know the percentage, maybe 25, 30%, that you can recover them to the point where you have to look to see their autism. May never be social butterflies, and you have to teach them all the rules of social engagement, but they can be very functional in life and have a job and have a relationship and kids and everything you'd expect from a human existence. So that's maybe 25, 30% of the kids I see. Another 50% are kids that we can get them a lot better. We can get them maybe where they can live on their own, they can have their own apartment, they might need help paying bills or reminders about taxes or those kinds of things, but they can be reasonably functional, have a life. And then there's 25% or so that I think these are the more severe, more genetic type autistic individuals where don't know that they're ever going to be able to be capable of living independently. But on the other hand, you can certainly help them quite a bit with their symptoms, where they're happy, they're not in pain all the time, they're living the best life they can live. So there's a whole spectrum of outcomes. But, when I'm saying recovered, I mean recovered. I mean, like, these people, you really lose the autism diagnosis. So there are kids that fit in that category. And it just, again, it depends on when do you start treating them, how early can you get to them, what is causing their autism, and can you do something about it? That's really what it comes down to.
We focus on hope a lot, and that's the hope that we all have. I mean, exactly what you said just now is what we all strive for. And when I meet parents and I'm talking to them, it's empowering to, as a parent myself, to talk to other ones. Then you just see a room full of folks that are fighting for their kids. There's nothing better than watching them fight for their kids, because ultimately our hope is exactly what you just said, that they will lose a lot of those symptoms. They may even fully recover from it and lose the diagnosis. That's the dream. But in order to get there, you focus predominantly on the gut issues. You focus some on the gut-brain connection. So tell us a little bit about what type of gut issues have been identified in autism.
There's a whole spectrum of issues that we've found with autism. I mean, one of the biggest ones is you just have a lot of abdominal symptoms in autism. It's not 100%. Obviously, if you've got a kid that doesn't have any gut issues and you're treating the gut, you're probably not going to make much progress. But the studies are suggesting somewhere around 75 to 80% of kids on the spectrum have some sort of gut issue. One of the big ones they've identified is this idea of dysbiosis, so that would be imbalanced bacteria in the gut. We have a whole microbiome, a whole gut ecology made up of bacteria and some yeast in the gut. There's evidence that a good 75-80% of these kids, that's imbalanced. The biggest thing we see in the gut is an overgrowth of certain species, one of which is called Clostridia. This is a whole group of bacteria. These are fermenting anaerobic, meaning they can't survive oxygen, anaerobic bacteria that make toxins. And so when you have too much Clostridia, it can create all kinds of problems for you. These toxins get into the bloodstream. They can affect behavior. They can cause pain. They can cause constipation, diarrhea, all these other things. So these are the kids that tend to walk around bloated. They can be rashy. When they do have a bowel movement, it sort of clears out the whole room because it smells so bad. That's your classic Clostridia person. By the way, you probably should have warned listeners not to listen to this after eating dinner. We're going to be talking poop. All right. Then there's also maybe 20 to 25% of kids that have yeast. Just for whatever reason, they have chronic yeast. And frequently both of these kids types are the kids that early on, they're colicky as infants, they get recurrent ear infections, they're treated with antibiotics, or maybe they got antibiotics at birth because mom was strep positive, or they were a C-section baby, or something like that. So these yeast kids, they're kind of more famous because one of the godfathers of integrative medicine, Sid Baker, he was one of the people that discovered, and it was all by accident. He had a neighbor who was on the spectrum but had all these yeast symptoms, And when he treated the yeast, the kid's autism got better. Sort of the brilliant observationalist and realized, hey, wait a minute, maybe the yeast has something to do with the autism. Definitely maybe 20-25% of kids on the spectrum that have yeast problems. All of these things create issues because there's this huge connection between the brain and the gut and the brain. And there's definitely signaling that comes from the brain down to the gut. Anybody who's been nervous and develops diarrhea knows that those connections are there. But the opposite's also true. Most of the connections are from the gut to the brain. So there's signaling from these organisms that actually alter behavior. There's signaling from these organisms that can create anxiety and that sort of stuff. And then we also know that a lot of the neurotransmitters, the chemicals that make the brain work, a lot of those neurotransmitters are actually made in the gut. So, for example, about 80-90% of all the serotonin in the body comes from gut organisms. If you don't have the right balance in the gut, it's going to affect your behavior, it's going to affect your brain development, and it's going to affect your ability to learn. The other thing is if you have a lot of Clostridia, nobody really knows what it's like to be in the mind of one of these kids, but if you have Clostridia, we know from adults that have a specific type of infection called Clostridium difficile or C. diff, we know that that causes an extreme amount of abdominal pain. So these kids could really be in pain 24/7, and then we wonder why they're unable to learn language or unable to learn how to read or unable to get social clues in terms of how to interact. Well, if you're in pain all the time, all you're focusing in is on the pain, and it's going to make it very difficult for you to go outside yourself and learn. But those are some of the symptoms we see. The other things we see in autism, there are some kids that just don't digest certain foods very well. There's some evidence out there, although it's controversial, that there might be a subset of kids on the spectrum that just don't make the enzymes that allow you to digest sugars, something called disaccharidases. So if you want to digest milk sugar or you want to digest table sugar, you need disaccharidases to do that. And there may be a subset of kids that just don't make those enzymes. And then we also know that there is a small subset of kids that develop a full-blown inflammatory bowel disorder that is unique to autism. This is something that's not ulcerative colitis. It's not Crohn's. It's something different, and we call that a type of enterocolitis. And again, these kids can be very, very sick with their gut. Not that common, but it's important to recognize it when it's there because treating that can make a big difference.
You said something a moment ago that really resonated with me. We hear discussions and we read papers and we have these different moments where we're talking to doctors and parents and we're all saying gut-brain connection. But you said just a moment ago, something as simple as having anxiety or stress can cause diarrhea. Everybody kind of accepts that. We all know that if you get stressed out, your body starts shutting down, right? That you can have physical reactions to the stress that's happening in your mind or the anxiety. To be able to reverse that and think about it from the stomach going to the mind is something that I personally haven't thought of it that way. And I imagine there's a lot of other people that are listening right now that haven't really thought about it in that simplistic of a form. And so that's interesting. The other thing that you were saying, would one of the things that we feel regularly as an adult or a child, we feel hangry. When we're really hungry, we get angry. We feel hangry. That's another one of the emotions that you could say you get serotonin from having the gut balanced properly, not eating. That's just a simplistic form of what you're trying to say, only yours is much more sophisticated. Is that fair, or is that?
Yeah, well, hangriness is probably from low blood sugar, and that's more of an insulin thing than a gut thing, but it's the same idea. What I would make it even more simplistic. How nice are you going to be if you have belly pain? If you have crampy abdominal pain, well, unless you're Mother Teresa, you're probably not going to be the friendliest person out there. It's going to affect your mood for your gut to be upset. Or if you're having, bouts of diarrhea, all you're thinking about is where is the bathroom rather than whatever interaction you're having with somebody. In its simplest terms, that is going on in our gut is going to affect our behavior. And obviously, it's a lot more complicated than that. And there's all kinds of both physical connections and biochemical connections between the gut and the brain. If you go outside the brain and the central nervous system, the gut has more neurons, more neurologic tissue than any other organ system. outside the brain. We always say the gut has its own brain. It's like the second brain, although a lot of us who study all this stuff think maybe that's the first brain and the thing in our head is the second brain that's responding to what's going on in the gut.
I really do find that fascinating, and I know that we've oversimplified it to the max here, but it builds such a foundation of why it's important to treat it. Even person that's going to say, that's nothing, that's hogwash, that person would have to buy into the idea that if you're feeling bad, you're not going to be your best self. And that these kids with autism are scientifically proven to have these issues. If I remember your stat correctly, 75 to 85% of them have these issues as an underlying condition. It has to be addressed at some point if you want to get their best selves out of them. My question is, how did the gut issues affect the psychiatric or the neurological symptoms of autism?
Well, I sort of alluded to one of the big things, and that's this idea of neurotransmitters being made in the gut. If you look at serotonin, I don't know the exact number, it depends on which paper you read, but let's say 80 to 90% of all the serotonin is made outside the brain. 50 to 60% of all the dopamine is made outside the brain. If you want to have the sort of the raw materials for normal brain function, you got to have the right organisms. And again, these are made by bacteria in the gut. It's actually important to have the right probiotic organisms in the gut in order to have the right brain chemistry. That's one of the big things. The second thing is this idea of autonomic signaling. Part of our nervous system is the autonomics. This is your sympathetic and your parasympathetic nervous system, and they're supposed to take care of sort of everything that's on autopilot. Your respiratory rate, your blood oxygenation, your body temperature, your heart rate, your blood pressure. All these things are controlled by the autonomics, and so is the entire digestive tract. Again, when you learn these things, you learn about how the brain controls the autonomics and the autonomics control the body, but the opposite is also true. The gut organisms directly interact with the autonomic nervous system. That feeds back to the brain and affects how the brain is working, and that can affect mood, and that can affect mental functioning, and possibly even the connections in the brain can be affected by that autonomic nervous system. And again, all this is heavily, heavily regulated. When I learned about the autonomics, I just learned sort of the top-down information. But it turns out that about 90% of the information goes the other way, that the gut is telling the brain what's going on, and the brain then responds. You have the direct involvement of the autonomic nervous system in terms of affecting the brain. And then the third element is actually these toxins, these neurotoxins. So these are toxins that affect the brain, neurotoxins that are produced in the digestive tract. They'll get into the bloodstream, they'll go to the brain, and again, they can directly impact how the brain works, good or bad. So you'll have some neurotoxins that mimic what neurotransmitters do. There'll be some neurotoxins that mimic things like opiates, like morphine. There'll be neurotoxins that agitate the brain. There'll be neurotoxins that raise something called glutamate. Glutamate will, keep you awake, so you need enough glutamate, but too much glutamate makes you agitated and irritable and violent. We think part of the reason why we see some of the behaviors in pans and pandas is because of excess glutamate. That would be the third big category in the ways that the gut can affect the brain. And then the final thing, and I don't want to get too much into this because this is a whole day-long lecture series in and of itself, but the gut is, that's where the immune system lives, right? You affect the immune system, and the immune system has a huge impact on the brain. And there's a lot of evidence out there now that maybe 70% of all autism is actually autoimmune encephalitis. So it's a chronic inflammation of the brain caused by an autoimmune process. And again, that's going to be heavily, heavily governed by what's going on in the gut.
And you said that was how much of a percent? 70 to 80%?
It was 70%. This was an autopsy study out of Harvard. You have to take it with a grain of salt because it's an autopsy study. But what they did was they evaluated brains of people with autism that had died for other reasons and then looked at telltale signs of autoimmune encephalitis. So what they found was there were deposits of what are called lymphocytes. These are white blood cells that are involved in, fighting infection, but they're also involved in autoimmunity. And when they evaluated the type of white blood cell that was present in the brain, they found that they were the cells involved with autoimmunity. You shouldn't have white blood cells in your brain. If you do, that's encephalitis. And specifically, these were lymphocytes involved with autoimmune responses. 70% of the samples they had evidence of those types of white blood cells in the brain. Again, 70% autoimmune encephalitis based on that study. Is that true of the general population? We don't know because it really hasn't been looked at. But again, it's just another factor that says this is not some magic psychiatric disorder that, I don't know, the evil humors bestowed upon your child. There are biochemical reasons why this is happening. And even if you're going to say, oh, it's genetic, yeah, but the genetics determine biochemical changes that then determine the outcome. And those are things that you can change. If we couldn't change biochemical outcomes, then none of medicine would work, right? That's what our medications do. That's what we do when we use herbs and dietary changes and everything. We're changing a person's biochemistry. And when we do that, we change behavior and we change outcomes of these, supposed psychiatric disorders.
That's incredible. How do the problems develop? You kind of mentioned a moment ago that genetics could play into this. Are there anything that we can do preventatively to help, or are there different methods of which these kids have these issues that we should be more aware of? How exactly does everything come to be?
What is the meaning of life? Okay. So,
I do. I feel like I'm talking to Yoda right now. Tell me more.
I mean, all this starts long before the child ever appears on this planet, and it really starts with mom. So the healthier mom is going into a pregnancy, a better outcome you're going to get. The healthier mom is during pregnancy. This makes a huge, huge difference in outcome particularly with autism. If you look at, there are some folks out there, Dr. Liz Mumper actually published a paper on this, and others, David Berger. These are people that treat, pretty much their whole practice is autism. And so it turns out that if mom brings in her kid who's on the spectrum and wants to have another baby, well, if you have a child on the spectrum, your risk of having another child on the spectrum is pretty big. It's somewhere in the 15 to 20% range if it's a boy. Parents are very afraid that don't really want to have another child as a way to reduce my risk. There is, and these are basic nutrients, methylated B vitamins, detoxing mom if she's not already pregnant, using fish oils, using probiotics, just some basic stuff. And what they found in Dr. Mumper's paper, it was around 300 pregnancies with no autism. And in Dr. Berger's series, he has over 1,000 births, and I think there was one case in autism out of 1,000. So again, if you're going to use the lower end, let's say 10% rather than 15 or 20%, but 10% in Dr. Mumper's group, there should have been 30 people on the spectrum. And in Dr. Berger's group, there should have been 100. If you use the 20% number, then you just double all those. Obviously, using nutrients during pregnancy and optimally before pregnancy can make a huge outcome with the child. The second thing is you really want to keep mom's immune system happy and calm during pregnancy. For years and years and years, the whole idea in taking care of a pregnant woman was to make sure her immune system wasn't activated. So they did not recommend things like vaccines because vaccines, by their nature, activate an immune system. Now, all of a sudden, they're doing flu vaccines, they're doing DTaP for pregnant women, and we really don't know what that's doing to their immune system. Plus, we have all these environmental toxins that can activate the immune system. We don't know what that does for pregnancy. So the bottom line is, if you can start with get mom healthy, detox, eat organic, don't eat foods that you're sensitive to, don't eat garbage, there's some good prenatal vitamins out there now. Not necessarily going to find them at CVS. Most of the herb companies now make prenatal vitamins based on Dr. Berger and Dr. Mumper's experience. Doing that can make a big difference. Once a child is born, no antibiotics. You absolutely have to have antibiotics and use antibiotics. make sure mom's diet is clean. And we recommend don't eat reactive foods. And unfortunately, we eat a lot of these, things like gluten, things like dairy, things like soy and peanut. They're just very common foods, but they're also very reactive foods. Eating a diet that's low on the reactivity scale, and there's lots of diets out there, anti-inflammatory kind of diets, and then making sure that mom's breastfeeding and making sure that mom's getting good nutrients herself that she can pass on to the baby. We know that biome, the gut health, starts in utero. There is a biome for the placenta. There's a biome in the uterus. When I went to medical school, the uterus was a sterile environment. And that would be incorrect. There are bacteria there. So the biome starts from the moment of conception, and that mom taking probiotics actually has a positive outcome for the kid. You want to make sure that mom's gut is set, that mom's eating well, that mom's taking probiotics, that her biome is balanced, because that means that baby's biome is going to be balanced. And then we just overuse antibiotics. Anytime an antibiotic is prescribed, you really want to determine, do you really need this? And ear infections are a good example. The vast majority of ear infections are viral. The vast majority of ear infections will get better in 2 to 3 days with no treatment at all. And yet we put every single kid who has an ear infection on an antibiotic in the United States. They don't do that worldwide, but we do that here. And those antibiotics, especially early on, less than 6 months, one course of antibiotics could disrupt your gut for the rest of your life. You really want to think twice and 3 times before using the antibiotics, because those can be a disaster. But those are things you can do, and anybody can do them. You don't have to be a doctor. You don't have to be an autism specialist. These are things you can do before you get pregnant, while you're pregnant, and what you can do, while your child's in infancy to try and establish that foundation of good gut health.
If we follow these methods, then we have a better prognosis of our future. But what happens if these things didn't fall into place the way that we've outlined in the last couple of minutes? What happens if we've skipped, fast-forwarded now to having a 3-year-old, a 4-year-old, a 7-year-old with autism? How do we help the condition improve? How do we, quote-unquote, fix it? How do we go back and reverse time and try to make things better? I know that diet played a big part in our story, and I've heard you say antibiotics are bad and probiotics are good, but there's also the question of, do you do probiotics or do you do inulin? There's so many different layers to that. Give us some guidance on what do we do to try to correct the situation.
How long do we have? Did you say 2 days, 3 days? I forgot. Okay.
We have 3 weeks.
Okay. Well, I mean, first and foremost, let's start with diet, because, again, this is something anybody can do. So the foundations of diet, the foundation of any diet, I don't care what diet you're using, but the foundation of any diet should be vegetables, and it should be variety. It's really difficult in autism to get a kid on a diet where you have a lot of variety, because they get so locked into eating only certain foods. If you're talking a 2-year-old, you can do something about that early on. You just sort of force the variety. When you're talking a 7 or 10-year-old, it's going to be more difficult. You're going to have to start introducing things slowly, but the objective is to get to a varied diet. The things you were talking about, inulin, prebiotics, you're going to get lots and lots of prebiotics out of root vegetables. They have inulin in them. These are the things that feed a healthy biome. If you want to look at what to do, that's where you start. You can look at reactive foods. There's lots and lots of diets out there. You can look at reactive foods, but the reactive foods tend to be things like gluten. Lots and lots of kids on the spectrum have the genetics that makes them gluten sensitive. Doesn't mean they have celiac disease, but just every time they eat gluten, it irritates their system. But if you look at just in general, what are reactive foods? It's going to be gluten, followed by corn and oats. It's going to be dairy. It's going to be soy, peanuts, possibly eggs, possibly tree nuts. You construct a diet that's really built around fruits and vegetables, quality meat, fish, poultry. It needs to be quality. If that animal's fed garbage, then the meat is garbage and you don't want to eat it. But that should be the foundation of the diet, and then moving forward with the variety part of things. And what they say, and this is very hard to do, but what they say is, we should shoot for 50 different foods per week. Spices count, but it should be 50 different foods per week. And that's hard to do because most of us are eating maybe 10 or 15, and most kids on the autism spectrum might be eating 5 to 10 or even less. So it's important to get that variety in. And that's a place to start, all right? So this is not the be-all, end-all, but that is a place to start. And I know lots of people that have made a huge difference in their kids' outcome simply by starting with a good diet. The other stuff, the probiotic question, there is a whole lot of evidence out there that says that if I take a probiotic, this idea that the bacteria that are in that capsule that I'm taking or the powder that I'm taking are actually going to make it to my colon and set up a colony is pretty small. Maybe 1 in a million, 1 in 10 million will do that, but the vast majority are going to die. And they're going to probably die in my stomach. They're never going to make it out of my stomach. We know that that probably doesn't happen. And when you label these organisms and see how many of them end up in the colon, you can't show that any of them do. This idea that you're going to populate your colon with a probiotic probably is not the way they work. We do know, however, that if you add in probiotics, you see changes. Certain probiotics help anxiety, certain probiotics help depression, certain probiotics can help irritability. If that's the case, they must be doing something. And we think what's happening is even though they're dead, whether they're living or dead, they are affecting signaling in the intestine. There's a whole bunch of immune cells in the intestine that sense what's in the intestine. There's a whole bunch of receptors that line the intestine that sense what's in the intestine. And those receptors and those immune cells will sense those bacteria, living or dead, and they will send off signals. And that signaling probably alters the environment. Because again, if you could wave your magic wand and change the pH or how the food's digested or the presence of butyrate or whatever the nutrient would be, if you can wave your magic wand and change the environment, you will change what grows there. And that is probably more how probiotics work than actually populating the gut. And, again, this is all science and evolution. The first probiotic journal, they only started talking about this stuff maybe 10 years ago. It's not like we were talking probiotics when I was in medical school a million years ago. It just wasn't a topic. Just learning the dynamics of what happens. But it's the same with bacteria in our food. What happens with that? Most of it's destroyed, and yet we know that if we eat fermented foods, we can improve the health of the gut for most of us. There's a lot in that we can do with diet alone, and you don't necessarily have to go out and spend $1 million on a prebiotic or probiotic. But the key thing with diet is you got to figure out how to get that stuff into your kid, and that definitely is not an easy task.
In our case, we were really fortunate. We saw results when we changed Lindsay's diet, and we took her from eating everything that you shouldn't, essentially, every type of processed food and everything that existed in the world. We changed it to being gluten-free, dairy-free. Of course, years later, we would learn that she had other intolerances that we were still giving her, but just those two shifts in her world, and I know that many kids have the same experience, changed her trajectory pretty heavily. We were fortunate that it happened quickly. I want to say that it happened within 2 or 3 weeks. What is the average amount of time that it takes when you really go cold turkey and you change a diet? That means no goldfish in between meals and no cookies after dinner. When you really go cold turkey and you change their diet, what could a parent expect an average timeline to be before they start seeing or not seeing results from it?
Yeah. The answer is it depends what the problem is. If you're talking about a kid that has issues with yeast and sugar, or a kid that has issues with food additives, food colorings, and that sort of stuff, it could be 2-3 weeks. If you change the diet to real food, nothing processed, nothing out of a box or can, nothing with preservatives and all that sort of stuff, but real food that's fresh that you make, and they have a problem with those things, 2 to 3 weeks. If it's a problem with a dairy allergy, it might take a month. If it's a problem with a gluten sensitivity, normally you'll see things in 3 to 4 weeks, but gluten, it might take 3 to 6 months. And so when I say gluten-free, I try to get my parents to commit to at least 3 months, but better 6 months to a year, because there are subtle things that gluten does that will take much longer to manifest. Typically, at a month, you should see a change, but that change could be as quick as a week, depending on what the issue is. So again, if the issue is sugar, then getting rid of sugar within a week, you'll have a better kid. Your kid will be behaving better. If it's dairy, it might be 3 to 4 weeks. If it's gluten, it might be 3 months. So it depends what the problem is. Again, I encourage people to stick with it for at least 3 months to see what you get. And then the other thing I have people do before they change the diet is, I always ask parents, what are your goals, right? So, if a parent comes in with a 17-year-old who has, a significant genetic anomaly and is nonverbal, and their goal is that they want this kid to go to Harvard, we're probably not going to reach that. It's going to be unreasonable. If you have a parent that comes in and their goal is they want this kid speaking, and they're 2 years old, well, then we probably have a chance at going after it. So you want to make sure, because I've had parents where the only symptom they're paying attention to is the thing that main goal. I want my kid to speak. Okay. So I'll have a child come in, and first evaluation, if they're wet behind the ears, they don't know anything about biomed, we're going to do a workup, and I'm going to say, hey, why don't you guys try a gluten, casein, soy-free diet for the next month? At the very least, no processed foods for the next month until we follow up, see what happens. So I've had cases where, I've got a kid bouncing off the walls, ripping up the office, stimming, and especially verbal stimming, you can't hear yourself think. And they come back a month later, and they're sitting in a chair, and they're calm, and they're looking at a book, and I ask the parents, well, any changes with the diet? They say, no, we haven't seen anything. And I sit there and go, well, is he still bouncing off the walls? Oh, no, he's a lot calmer. Oh, okay. Is he stimming? Oh, stimming's a lot better. Is he banging himself in the head? Oh, no, he stopped doing that. Oh, well, why do you say it didn't make any difference? Well, he's still not speaking. So it's important for parents to write down not just their main concern, but sort of all the symptoms that they see, so that a month later, 2 months later, 3 months later, we know whether that's made a difference. Because, again, a person may be looking at just speech or just ADD or just violent behavior and be ignoring all the other symptoms that the child has. Typically, a few weeks would be sort of a standard answer, unless it's just a gluten problem, in which case that might be longer.
That's a really good rule of thumb. So this all makes common sense to me. And it didn't make common sense to me until somebody pulled back the curtain and they showed me how all of this works. But once you see it and you understand that bodies are a representation of what we feed them and how we treat them, they're going to respond to the environment and to what we put in them. It all starts making more and more sense to you when you're trying to identify things that aren't working at their highest level. And if it makes sense to me as a parent, how would you explain the fact that mainstream pediatrics don't recognize these issues the same way, or perhaps suggest the simplicity of trying to clean up diets and trying to clean up environments the same way as autism doctors and biomed doctors?
Oh, boy. There are so many aspects, so many facets to that question. For starters, I think a big problem that we have with medicine is how we are taught medicine. All right. So the whole process of medical education is not a process of questioning and learning answers through research and through answering those questions. It's really a master-disciple relationship where you go to the mountaintop, and, the mountaintop is medical school. You go to the guru, your professors in medical school, and the guru bestows upon you the ancient wisdom and knowledge and, everything you need to know, and also bestows upon you this attitude that I'm telling you everything you need to know, everything else is garbage. It turns out that a lot in medicine is simply somebody's opinion. And I am always flabbergasted by how much I believe to be the gospel truth was actually somebody's opinion. And it's not based on, the prospective, double-blind, multi-center, large, placebo-controlled study. It's just based on, I think this is going to work, so let's do it this way. And unfortunately, in medical school, you learn early on that you don't question your professor. That's a quick way to get out of medical school early without the degree. You can ask questions about, the subtleties of the treatment, but you don't actually question the treatment itself. You don't question the theory behind the treatment. Plus, you're totally stressed out, you're sleep deprived, and everybody around you is saying the same thing. So you're pretty much brainwashed. And, I always compare medical education to legal education. So in law school, the professor will say, well, Mr. Neuenschwander, what do you think of Roe v. Wade? And I'll give my opinion. And then the professor will question that opinion by taking the opposite side. So we hate lawyers because they can take any side of an argument. That's a good lawyer, right? But we hate them because they don't stand for something. As a lawyer, you want somebody that can see both sides of the argument. We're never taught that in medical school. So that's the first problem. And in medical school, they do not teach you about nutrition. It may be different now. When I went through medical school, we had a week, 1 hour a day for a week, where we talked about nutrition. And basically it was, if you don't have enough vitamin C, you get scurvy. If you don't have enough vitamin D, you get the rickets. It was that sort of thing. It really wasn't about nutrition. It was about diseases of vitamin deficiency or vitamin excess. That was it. You don't get a lot in nutrition. So right away, there's a bias that nutrition just isn't important, because if it was, we would have spent a lot more time learning about it. And then you just have these studies where who's going to fund nutritional studies? So there's been this whole scam in the world of nutritional studies where you had companies that were heavily invested in garbage food funding some of these nutritional trials, showing that high fructose corn syrup is perfectly fine, that there's no problem using white flour or food additives, and that you think these studies are coming out of Harvard because that's where the researcher was from. But when you dig deeper, it's funded by a conglomeration of companies like Coca-Cola and Pepsi and McDonald's and these kinds of people. So you have conflicting data in the literature to start out with. It's not very good research. And it's not like drugs where you have a vested financial interest in showing that something works. And so we don't get the education just coming out of school. And because of the way we're brainwashed, it's very hard for us to accept that nutrition makes a difference. Now, from where I'm sitting right now, it's like, oh my God, how could anybody think that nutrition doesn't make a difference, right? But there are doctors that believe that. The only thing that makes a difference is a medication. That's one big element, how we're trained, how our minds work, and the fact that we end up being very brainwashed and we believe what we believe. It's like a religion. We believe what we believe because that's what we were taught, not because that's what we researched independently and discovered that that is what is true. Where I'm at right now in my life, I pretty much have to question everything that I believe to be true because it may be simply something that I was brainwashed into thinking and have never really researched and have just been assuming that it's true because that's what my professor told me. The other thing we're dealing with here is this idea of a psychiatric disorder. And I'm not sure what happens in the training of a psychiatrist, but a psychiatrist is a physician. They're an MD or a DO. They went to medical school. They learned biochemistry. They learned anatomy and physiology and all the things that everybody that goes to medical school learns. And then they become a psychiatrist, and somehow they stop being doctors. There are no tests, no biochemical tests in psychiatry. If you're lucky, your psychiatrist will make sure you don't have low thyroid if you're depressed, low thyroid, low iron, something like that. They don't do a blood test and say you're depressed based on a blood test. They don't do a scan and say you're bipolar. Do any of that sort of thing. They basically practice their trade the same way they have for the past 150 years, which is they ask you a bunch of questions, and based on your answers, they make a diagnosis. Because autism is classified as a psychiatric diagnosis, there's this belief that biochemistry has nothing to do with it. To me, it's just mind-blowing because it's not just about autism. It's about every mental health issue. That I don't know what people believe, that the mental health fairy visits your house one night and you wake up the next day bipolar. I don't know what they're thinking. But we know it's biochemical. Otherwise, none of these drugs would work. And if it's biochemical, then at the basis of it, diet should make a big difference. And the studies there's just not a lot of studies because who's going to fund them? right? Nobody's going to pay for these studies. Nobody profits off these studies. And even if you take something simple like gluten-free diet, does it make a difference? If you look at the literature, I think there's been 16 or 17 studies at this point. I don't think any of them had more than 150 people in them. And it's right down the middle. Half of them said it made a difference, half of them said it didn't. So you got all this conflicting information, and most doctors are just going to throw their hands up and say, it doesn't work, right? Until they have a kid on the spectrum, or they have a grandchild on the spectrum, or one of their close friends has a kid on the spectrum, and they see the changes that happen with diet. Then they become a believer.
I'm certainly a believer, and part of the reason that this podcast is called The Vortex is because I feel like that's what happened, is that I had this moment early on when it was talking about diet, when I had somebody explain to me how important diet was, that I had this vortex in my mind just open up. And once it opens, you just see everything a little bit differently. And it's incredible. Like I said, you start looking at it as though it's common sense, but it's not common sense until somebody points it out to you, until you look at it, and then you can't see it any other way. We have a couple different parents that have asked some questions, and if you have a few more moments, I'd like to get your input on these. One of them has a child that's 10 and 5. The 10-year-old is starting to become more verbal. He's come a long way and repeats himself. She's wanting to know how do we get him beyond that. He can read, he can do other things, but it's a verbal stimming essentially that she's trying to see how to progress.
You have a 10-year-old and a 3-year-old?
And a 5-year-old.
5-year-old, okay. Well, I mean, first of all, echolalia is the first step to gaining language, so it's not necessarily a negative thing. When 2-year-olds, 1-year-olds are picking up words, they just repeat what adults say, and they repeat it until they get it right. The big thing with speech is to deal with making sure that you don't have barriers in the brain that are preventing the child from making those connections. I go back to the basics and look at what is the gut looking like? Do we have issues with Clostridia, yeast, that sort of thing? Work on the gut. There are very specific nutrients that have been associated with improving speech. One of them is something called sulforaphane. This is a broccoli sprout extract, a 3-day-old broccoli sprout extract. Now, when you're getting sulforaphane, you want to make sure that it is mixed with an enzyme called myrosinase. So there's a few products out there that have both the sulforaphane and the myrosinase in them. One of them is called Avmacol, AVMACOL. That's actually been studied in the literature. But what this stuff does is it helps remove some of those barriers and can improve the connections. And then the other thing is to look at the child, because a lot of times the scripting, the echolalia, those kinds of speech patterns, they can be simply a manifestation of anxiety. It's kind of like a verbal stim, and dealing with the anxiety can sometimes help that quite a bit, either with nutrition or with medication. If you walk in the door and your goal is to get your kids speaking, it's one of the most difficult things to do. And frequently in those situations, you really want to know what the details are for that particular child to try and figure out what are the barriers and then what can you do to remove those barriers. And speech sometimes is a mystery. I've got kids that, they can read, they can comprehend what they read, they have language in their brain, but they can type on a keyboard, they can use a communicator. They can't actually get the words out of their mouth. And I don't necessarily understand that. Again, looking at, is there something going on gut-wise that might be interfering? Is there nutritional elements that might help? So the other things besides sulforaphane that could be very helpful are things that help with brain inflammation. So we have success with fish oils. We have success with curcumin, the turmeric extracts. I've even had parents have success with CBD oil, which is anti-inflammatory. The other big thing we use is low-dose naltrexone. This is also a big brain anti-inflammatory. So again, if you got a kid that's more of a pandas kind of kid, or that has that evidence of that autoimmune encephalitis, then using one of those anti-inflammatory type things can be very helpful.
I have another parent that is curious. Their child is 15, and they're trying to figure out how to help them exercise more regularly, which seems like that would be probably a bigger challenge at that age. Do you know of any? I mean, other than just the strong will of a child that's 15 not wanting to, is there something that we could maybe change in their diet that might encourage them to be more active?
Wow. That is nearly impossible to answer without looking deeper into what's going on with the child. You can have elements where they don't want to exercise or they don't want to be engaged because they don't have, like, they're low on oxytocin. They're not engaging in their environment because they're not bonding the way they should. But a lot of times that's getting into the deeper question of how do you motivate people. And it doesn't really matter if you're on the spectrum or not. How do you motivate a 15-year-old? Well, you got to figure out what they want and figure out a way that you can work out a deal with them that they do what you want so they get what they want. But again, that's almost an impossible question to answer.
Fair enough. And then lastly, I'll ask you, there's a mom of a 5-year-old, and she's wanting to know if there is a best, so air quotes, if there's a best supplement or diet that would help with anxiety.
What I tend to do with kids that have anxiety is to start out with just a broad supplement for autism. And I mean, specifically the ones I use, and I have no financial interest in any one of these. One is just called Spectrum Needs. It's a powder. You mix with water and drink it. That's good and bad. It's good because it's not a capsule. It's bad because you have to deal with the taste. Now, I think it tastes pretty good, and I can't stand the taste of B vitamins, so they've done a good job hiding it. But that's one of them. The other one is a vitamin from Dr. Adams, James Adams, called ANRC Essentials. And again, you can get either of these on, I think you can get them through Amazon, you can get them online. That's a capsule, but it's the same idea. These are just the nutrients that tend to be deficient in autism. So I tend to start with that, just a general broad spectrum nutrient, and see if that helps. Specifically for anxiety, and here's where things get really tricky, because anxiety is a symptom. We're back to cough. Well, is a cough because you have asthma? Is a cough because you have COVID? Is a cough because you have, tuberculosis, or you have pneumonia, or you have a viral infection, or you have bronchitis? Saying anxiety is like saying cough. So you can have anxiety because you have inadequate GABA. So GABA is one of your neurotransmitters in your brain. You have low GABA. The best way to boost GABA is actually using something called theanine, theanine. That's an amino acid. It's actually found in green tea, but you can get it as a supplement. Doing a couple hundred milligrams of theanine 2-3 times a day can make a difference. For a 5-year-old, maybe a couple times a day. You can have anxiety because there's low serotonin. Now, that's a completely different set of nutrients. So if you have low serotonin, that would be more using tryptophan or 5-hydroxytryptophan or something like that. You could have anxiety because you have too much dopamine or you have too much noradrenaline. And, that's a completely different set of nutrients there. You'd be dealing more with some of the adaptogenic herbs like ashwagandha or ginseng or something like that for that type of situation. You could have anxiety because you have a glutamate excess. There you'd have to use like a lithium orotate or boron or one of these minerals that help, or even using a medication to help block glutamate. To say anxiety, again, it's very hard to determine. And this is part of why we do testing. But if you're talking just across the board anxiety and autism, the first thing I would reach for is probably theanine, because that does improve GABA signaling, and that can sometimes help quite a bit.
So then my last question for you, and I so appreciate your time. We all appreciate your time in talking with us today. A parent that is hearing this and it's resonating with them and they're saying, okay, these are all things that I should do, or I want to look into it more closely. I need to definitely dial in the diet. What is the first step? Do they make a diet change going rogue, doing it solo? Do they need to go to a doctor so that they can monitor it with them, so that somebody's giving them perspective like you did with your patient that wasn't speaking yet, but so many other symptoms were improving? What should their first step be in order to start looking into the gut?
Yeah, the first thing, and there's a lot of things you can do before you ever go to a physician or a practitioner, and encourage to find somebody that's autism savvy. Anybody can do a gluten, casein-free, soy-free diet. Just have a plan before you start. The beautiful thing about the internet is that there's lots and lots of support groups out there. You can learn from everybody else's mistakes. But the important thing with a dietary change is to have a plan before you make the change. Don't say, oh, I heard Dr. New this morning, I'm going to go ahead and start my gluten, casein-free, soy-free, peanut-free diet on my child for lunch, and then not have anything to feed them because you haven't prepared. So you want to make sure you have a plan ahead of time, but you can get started with that. And diet is really the basis for everything. Before you're reaching for a probiotic, a prebiotic, before you're reaching for a broad spectrum supplement or any of the things we talked about, you really want to go with the diet. I don't see any problem with parents doing that on their own as long as they have the information they need to replace one food with another. When you take out gluten, you lose B vitamins, you lose soluble fiber because that's what's in wheat. Take out dairy, it's mainly protein and fat. People worry about the calcium, but the calcium in dairy is not all that usable. I don't particularly worry about replacing calcium in dairy. It's in anything green. You take out soy and peanuts, that's basically just protein. You just want to make sure that you have something to replace it with before you take it out. And then you have to figure out a way to make that transition. Some parents just go Marine Corps. We're just changing it, 100% in one day. For most people, it's better to start with snacks and just ease your way into the diet that you're looking for. Much easier on the kid. Certainly suggest to parents to do that sort of stuff first, because if you get great results with diet, then maybe you don't ever need to see a doctor like me. Maybe that's enough to get your kid pointed in the right direction and moving towards healing.
And if they start with just doing snacks, obviously that extends the timeline on how long they will see a result or could see a result. Right.
The timeline that I was talking about earlier was once you're 100%. Okay. So 100% gluten-free, 100% dairy-free, that's when the clock starts ticking. Because again, if you're eating gluten and you actually have a big gluten sensitivity, then every time you eat that gluten, it's going to set off your immune system and create, brain inflammation, all that sort of stuff. Saying my kid is 80% gluten-free, that's not gluten-free. And you might see benefit with 80%, but you're not going to see benefits the way you would with 100%.
You're such a great wealth of knowledge. I'm grateful that you took time to talk with us today. And I know that anybody that took a moment to listen to this conversation has got some notes that they're going to want to follow up on as well. I appreciate your time today, and I appreciate your insights. We're going to have some links on the notes, the show notes portion of this episode so that folks can see how to contact you. Do you have any other last words that you want to share with anyone before I let you go?
No, I just, I'm going to put a shameless plug for Medical Academy of Pediatrics Special Needs. This is a group I'm involved with that we're involved with training practitioners on biomedical approach to autism. I would encourage parents, if they are looking for a physician, that's a good resource because at least people that are involved there have had some training in how to approach the autism problem.
Well, thank you very much, Dr. New. It's been an absolute pleasure talking with you.
Well, thank you so much.
The content within this post and all the Vortex podcasts is not intended to be a substitute for medical professional advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have read in this blog or heard on this podcast.